Hello, and welcome to the presentation on the topic of self-disclosure by Asra Siddiqi. What is self-disclosure? Self-disclosure is the process of deliberately revealing information about oneself that is significant and that would not normally be known by others. So self-disclosure must be deliberate. If you accidentally mention to a friend that you're thinking about quitting your job, then that information doesn't qualify as disclosure. Besides being intentional, the information must also be significant. Volunteering trivial facts, opinions, or feelings hardly count as disclosure. The third requirement is that the information being disclosed is not known by others. It is important to know that self-disclosure doesn't involve dumping everything about yourself on everyone from close friends to complete strangers. Obviously, self-disclosure needs to happen in the context that is appropriate for the particular relationship. The reasons for self-disclosure can be catharsis, self-clarification, self-validation, reciprocity, relationship maintenance and enhancement, identity management, social control, and manipulation. One of the first reasons is catharsis, which can be the purging of emotions or relieving of emotional tension. In many cases, people disclose information just to get the feeling off their chest. This is commonly seen when it comes to patient and physician confidentiality. And sometimes the physician needs to vent and tells other coworkers, family members, or friends about the case they saw earlier, which can cause problems. Self-clarification. Sometimes you can clarify your beliefs, opinions, thoughts, and attitudes and feelings by talking about them with another person. This is seen a lot in healthcare because all these attributes are the fundamental basics of applying their research on a particular public health issue. Self-validation. This is when a person discloses information with the hope of obtaining the listener's agreement or to get the validation of their behavior. Most physicians use this tactic when deciding what is best for their patient. They discuss their decision with a close coworker to get the confirmation on their belief. Reciprocity is a repercussion of your self-disclosures on another person. There is no guarantee that your self-disclosures would trigger self-disclosures by others. By your own honesty, you create a climate that makes others feel safer, even obligated to match your level of honesty. Doctors and physicians use this technique often when trying to relate to a patient in care. There is a large body of research that supports the role of self-disclosure in relation to success, since there is a strong relationship between the qualities of self-disclosure and to personal relationships. This can also deal with patient-to-physician confidentiality. If the patient knows the physician longer and has some sort of family ties with the physician, they are more likely to be comfortable talking with them about the problems they have regarding their health. Identity management occurs when we reveal personal information to make ourselves more attractive, declaring that self-disclosure has become another way of marketing ourselves. On the other hand, when it comes to social control, revealing personal information may increase your control over another person or situation. This is most likely to happen in the workforce when one employee reveals information that benefits the company and gets rewarded for his or her disclosure. Lastly, manipulation occurs frequently in the job force, as many try to diminish others in hopes to control a situation or a position. This happens when the act of self-disclosure is calculated in advance to achieve a desired result. While self-disclosure is important, remember that communication means sharing of information from both sides. And if you are overwhelming the other person with too much information about yourself, or information they really have no interest in, then the whole thing is going to backfire, because you will appear selfish and self-centered. When speaking to groups, it's always a good tactic to share a little of yourself as a person so you can overcome depersonalization barriers to group communication. Often the best way to self-disclose in groups is to tell a real personal story that is relevant. This is the end of the presentation. Hope you enjoyed it and learned something new. See you next